In March of 1981, doctors noticed 8 cases of Kaposi sarcoma, a rare form of a benign cancer that tended to occur in older people. The doctors noticed 8 cases in young gay men. About the same time in California and in New York City, a number of cases of a rare lung infection called pneumocystis carinii pneumonia were also seen. And doctors began to wonder if these two were related. Over the next months, more and more cases were found amongst gay men. And at first, the disease was called GRID, or gay-related immunodeficiency. Some people called it AIDS, acquired immunodeficiency disease. Some called it a gay cancer. But for sure, it was affecting the gay community. Later on, though, by 1983, more and more heterosexuals were being infected by this virus. At first, they didn't know exactly what was causing it, but by May of 1983, doctors at the Institut Pasteur in France reported that they had isolated a new virus, which they suggested might be the cause of AIDS. It wasn't long before the new terms were given. HIV being human immunodeficiency virus, and AIDS being acquired immunodeficiency syndrome. Now, a syndrome is a condition, but the virus is how someone is infected, and that became known as HIV and AIDS. This brings us to the question, what does HIV do? How does it affect our body? Well, HIV destroys the immune system of the body by attacking our CD4, or another name is T helper cells. Now, those are little white blood cells that our body produces to attack viruses that invade our body. Most of the time when viruses come into our body, we might get flu-like symptoms, we'll have a headache, we'll get sick to our stomach, we'll have a fever. But what happens is that those white blood cells are released from our immune system, they go and attack that virus, and in a few days, that virus is destroyed, or the effects of that virus are destroyed, and we begin to feel better. The problem with HIV is, this particular virus, is that it destroys those white blood cells. A healthy body may have 800 to 1,200 of these little healthy white blood cells per million of such and such, but the virus begins to destroy them. And as it begins to fall, it allows opportunistic infections to develop. Now, those opportunistic infections are what begin to really make us sick. So, how does HIV occur in the human body? How is the virus spread? Well, there are 4 ways, and only 4 ways. Number 1, blood-to-blood contact. Now, that can be through sex, and most often that is the case. On occasion, it has been through a nurse being pricked with a needle. Often it is through IDU drug users, intravenous drug users, people who share needles. A little bit of blood is left in that needle and they put their drugs in and pass it on to somebody else. But blood-to-blood contact. Number 2, vaginal fluid. So a female can pass it on to a male through the vaginal fluid. A male can pass it on to a female through the semen. And it goes into the body that way. Also, mother-to-child contact, and that can be a mother's breast milk, or it can be even through birth. The good news about birth is that there is a pill now that's available, nevirapine, that if given to the mother just 1 week before she gives birth, reduces the rate of infection in the child. And in fact, if she has cesarean with that, greatly reduces the child's infection to a possibility of about 2%. Those are the 4 ways that you can be infected with HIV. Blood-to-blood contact, vaginal fluid, semen, or mother's breast milk. Now, there are ways that you won't be. One is through a mosquito. Mosquitoes don't take blood from me and pass it on to you. They take a female mosquito will come and take some of my blood to hatch its eggs. And once those eggs are hatched, she's satisfied and she moves on. But she gets the blood from me and doesn't get blood from someone else. It's not passed on. Malaria is a different story because malaria stays on the beak of the mosquito. And so the mosquito will pass that on from one to another, but not HIV. You don't get HIV through rubbing two wounds together. That would have to be very, very deep wounds, and you'd have to have blood flowing from one wound of one body into the other. So you don't get it through that. You don't get it through a haircut, and you don't get it through those types of things. You do get it through blood-to-blood contact, vaginal fluid, semen, mother's breast milk. Blood tests are now given to everyone. An HIV blood test is given to everyone who donates blood, so it's not passed on that way. So we're pretty sure we're down to the basic four. We know how it's spread, and it's always wise to be careful in those 4 ways. So if we know that there are 4 ways of HIV transmission to the human body, then there must be high-risk groups of people whose behavior reflect the easy passage of that infection, of that virus. Sexually active homosexual and bisexual men is one high-risk group. The reason being the type of sex they have is conducive for transmission of HIV. Often, homosexual men also have numerous partners, which raises the opportunity for HIV infection. Heterosexual men and women, well, if you're a monogamous, faithful person to your spouse, you do not have to really worry about being infected with HIV. But if you're a person, a man or a woman, who is actively sexual with numerous people, your possibilities of infection rise drastically. If you have multiple sexual partners, you're going to be probably more susceptible to HIV infection. People who share needles. You know, you see people who make homemade tattoos. They're going to be more susceptible to HIV infection. A professional tattoo artist will use a sterile needle, and you'll see them use that right in front of you. But homemade tattoos are very, very dangerous. Piercings, the same way. Intravenous drug users, people who share a needle. From using drugs, there's a little bit of blood left in the syringe, and one drug user passes that on to the next, and to the next, and pretty soon numerous people are infected. And of course, as I've said, babies who are infected by their mothers, either through breast milk or through birth. But most likely now, today, in many countries of the world, it's through mothers nursing their babies. So now that we know that HIV is spread 4 ways, blood-to-blood contact, vaginal fluid, semen, and mother-to-child contact, let's remember that it's not spread through casual contact. You're not going to get HIV by giving someone a hug who is HIV positive or has AIDS. You're not going to get HIV really by even kissing that person, because HIV is not spread through saliva or tears or urine or sweat. Those body fluids don't carry the virus. You're not going to become HIV positive from a mosquito bite or through the air, being in the same room with someone who's HIV positive. And you're not going to get it by carrying food into the person or even sharing food with someone who's HIV positive. And you're certainly not going to get it from a toilet seat in a public setting. So what are the symptoms of HIV infection? Well, the first stage of HIV infection is called acute infection. Acute HIV infection. And because HIV is the human immunodeficiency virus, it affects the body the same way all viruses do. You get a flu-like symptom for 1 to 3 weeks. You get this fever and a fatigue. You might have swollen lymph glands. You might have a throat inflammation. Maybe your muscles ache. You might get a skin rash. You might feel sick to your stomach or have diarrhea. All of those are symptoms of, well, the flu. But they're also symptoms of HIV infection. The thing to remember is that you can't tell a person has HIV just by looking at them. The second stage of HIV infection is called asymptomatic HIV. This is when the virus works its way into your lymph nodes and for the next 3 to 20 years, slowly, very slowly, begins to destroy your immune system. There's a slow enlargement of your lymph nodes. There's a gradual decrease of your CD4 T cells. There's a gradual decrease of the effectiveness of the immune system all the way through, and thus you get more flu-like occurrences. And you may have flu that lasts longer than it used to. You may receive more and more sickness, and you may experience times that you're not sure, why don't I get better? That could last from 3 to 20 years, though. And so many people with HIV who are infected or were infected years ago don't even know it. That's called asymptomatic HIV. Up until this point, I've been speaking mostly of HIV, the human immunodeficiency virus. But we need to talk about AIDS as well. AIDS, the acquired immunodeficiency syndrome. If you'll remember what I said, a syndrome is a condition. And so AIDS is a condition of having HIV infection. Now, it's the final stage or the latter stage of having HIV. Everyone who has AIDS is infected with HIV, but not everyone who's infected with HIV has AIDS. I'll tell you why. When your body begins to lose the immune system that God has given us and created us with, and your T cells begin to drop, eventually the diseases and infections that come against you will, in a way, have their way. They will take over. You'll be sicker longer. You'll find that you don't feel well very well often. You'll find that these opportunistic infections like thrush and Kaposi and PCP, all of these types, and I think there's about 30 of them, they'll begin to take its effect on your body. And your T cells begin to drop. Once they drop down to about 200, and you've had an opportunistic infection, you have the diagnosis of AIDS. So AIDS is the final stage, or the last stage, of HIV infection. You have, with that, muscle wasting. Sometimes people get tuberculosis. There's fungal and yeast and bacterial infections. There's chronic weight loss, diarrhea, loss of appetite, neurological conditions such as dementia, and so on. Again, it's when the CD4 T cell count falls below 200. And that's when it's recommended that you begin to take the HIV medications. How is it diagnosed? How is it determined if you are HIV positive or if you have AIDS? How does it work? Well, there's a test given called the ELISA test. It's an antibody test which looks for what I call the skeleton of the virus in your bloodstream. If that skeleton, the antibody, is there, then they'll do actually 2 more tests before the doctor will sit down with you or the nurse and tell you you're HIV positive. Now, because of confidentiality laws in the United States, and I wish those laws were all over the world, the doctor's not allowed to tell anybody else, or the nurse is not allowed to tell anyone else. And so the confidentiality level is much higher than much of the rest of the world. But there are other tests as well, the Western blot or the oral saliva test. There's a rapid test. There's also a test where you prick your finger and take the blood. Those are not quite as reliable, but they're very good tests as well. But the idea is that you're tested, you're HIV positive. Now, how do we find out if you're where you are with AIDS? How far into the diagnosis? So they do a count on your CD4 cells. They count them. They actually give a certain number per little tiny area, and that's your count. Whether it's 200 or 500 or 643, eventually it gets down to 200, and if you have had an opportunistic infection, then you'll classify it as having AIDS. Once you have AIDS, then they begin to monitor. They'll hopefully put you on the HIV medications that are called ARVs, antiretroviral medications that are available if you are able to afford them, or if you live in a country that provides them, or if you receive services that provide them. Sorry to say, only 11.4% of the people in the world receive those medications. We have a long ways to go before those medications are available to people around the world. They're not inexpensive. In the United States, easily, HIV medications cost between $2,000 and $3,000 per month for people, and most of that is carried by the medical association of either your insurers or the government. They carry the cost of that, bear the cost of it. So it's very, very difficult and challenging once you become HIV positive. It's not as simple as, well, I'll just take a pill. There are side effects to those pills that are very, very toxic, very harsh, something known as lipodystrophy, where the fat in your body falls out and distributes unevenly in your body. Something called neuropathy, where your legs and your feet hurt and sting. There's other side effects, fatigue from the medications itself. It's not easy even taking the medications. Thank the Lord that life expectancy for someone taking the medications now today can be between 20 and 35 years. So that's great news. It's also sad that the body builds a resistance to these medications, and within 3 to 5 years, your body might reject the very medications that are saving your life, and you'll have to be placed on a new regimen of these medications. Good news is there's about 30 of these medications that are now available, and so if your body does reject one, you can most likely go to another, although that's not true for everyone. And so there's these great challenges that are facing HIV and AIDS around the world. It is a very difficult situation. It is not easy. It affects the poor most sadly, because they don't have the resources available. But the important thing is, if you think you're positive, be tested. I've been tested a number of times, even though I'm not HIV positive, and I know it, and there's no way I could have become HIV positive. But going through the test has given me a sense of understanding and helped me to better empathize with those who are being tested and those who are facing their life with the possibility of being HIV positive. So let me share with you some of the numbers related to HIV infection. 34 million people are today living with HIV worldwide. 34 million people. And when you add the number of people affected, as I said earlier, that's your family members and your neighbors and the people you go to church with, the people you work with, the people you meet down the street that you're friends with. You're talking about maybe 400 million people are affected by HIV. Now, of those 34 million people infected, 2.2 million are children. Children who were infected by their mother and their father and infected through birth, and now have to live this life on this earth with HIV. A very sad and difficult life for 2.2 million children. Since 1981, 30 million people have died of HIV infection. Huge number. The thing is, a quarter of the people infected around the world with HIV don't even know it, because it takes so long for it to go from asymptomatic to the position of HIV infection, where you know you're infected. It's spread day by day by day. I think every day about 6,400 people are infected every day somewhere around the world. In 2010, 2.7 million people were infected with HIV. And 1.8 million people died, men, women, and children. And then, of course, the last statistic is 16.6 million AIDS orphans are facing life on their own. Now, an AIDS orphan is defined as a young boy or a girl, 15 years of age or younger, with only one parent. In other words, a mother could still be alive and you'd still be an AIDS orphan. The reason being, your mother is susceptible to disease and sickness and can't work. You would think that with such great resources, with money and education and research and the ability to communicate so easily, that HIV and HIV infection would be down in the United States. But it's not the case at all. As many people are being infected this year as 15 years ago. Why? Because people think it's a chronic disease. It's not going to happen to me. Yet, 1.2 million Americans are today living with HIV infection in the U.S. 619,000 have already died. 47,129 people were reported infected with HIV in just the year 2010. And notice that 45% are Black African American, 22% are Hispanic, and 28% white. The 45% are mostly young girls between the ages of 15 and 29 who are being infected by their boyfriends. It's sad. HIV is not just a chronic disease anymore. It is still a deadly disease. It will kill you. Oh yes, you may be able to take the medications, and they may give you a long life, 25, 30, even 35 years. But the side effects of those medications are huge. Wow. It's a tough life. I wouldn't risk it. It's not worth it. The numbers prove that we're not really being very successful at what we're doing. There's only one hope. The reason that those numbers keep rising, and not just in the U.S., but really all over the world, is that people have this attitude. It can't happen to me. I'll tell you this, that's a myth. That's a misconception. It can happen to you if you start living in such ways that promote HIV infection. Believe me, it can happen to you. Here's another one. I only had sex one time. I remember a young woman called me who had just had sex one time with her fiancé. What she didn't know was that he hadn't had sex just one time, and he had acquired this virus, and he passed it on to her. She was heartbroken, and now for the rest of her life she has to deal with this. AIDS is chronic. If I get infected, I'll just take the medicine and I'll be fine. Remember what I said. It's not just fine. The virus mutates and it becomes resistant to the drugs. Not only that, the virus attaches to the DNA. And so it becomes your own personal infection. And if you, who are HIV positive, have sex with somebody else who's HIV positive, you do what's known as reinfection. In other words, you get their infection on top of your infection, and you cut off years from your life. 50% of all new infections are resistant to the meds. I'll tell you, don't listen to and say, well, he loves me. He would never infect me. Don't listen to that. You do what's right. Or don't say, you know, he'll tell me the truth, or she'll tell me the truth. Listen, the truth is, stay away from HIV. Don't do things that'll promote it. Be wise, be smart, and don't get infected with HIV. But what if you have become infected? What do you do then? Well, let's look at first on how is HIV and AIDS treated. First of all, the doctor will evaluate how long you've been infected, and what the status of your immune system is, and what kind of symptoms you have. Those things will come into play in determining what kind of treatment you'll receive. Some doctors like to put people with HIV on the medications right away. If they're available and if you can handle them, they'll put you on right away. Some wait until your viral load gets down to, or your CD4 count gets down to 200. But the doctor will help with that and make decisions with you on that. Good nutrition is important, especially if you're in a country that does not provide the medications. Then start washing your food with clean water. Make sure your food is clean. Don't eat food that is from the bottom of the water, like shrimp or even most fish. Stay away from those things because they eat things that are not healthier for you, and eat things that can promote even greater infection. So stay away from certain kinds of food that don't help you. Work towards good nutrition as best as you can. I know you may not have money. I know you may not have access to the medications, but do the best you can. That'll help your life to feel better and be better. Regular medical and dental visits are important. Preventative treatment for opportunistic infections if possible and if necessary. So do those things that'll help promote a healthier life for you, and you'll find that your life will be healthier and you'll live longer. So what if you think you are infected? What if you're pretty sure you might be? Then get tested. That's the best thing. Get tested. You'll know. And one way or the other, you'll be able to face tomorrow. Get tested. and find out what tomorrow holds. If you are positive, there are things to do. If you are not, then you'll know and stop behaving in such ways that'll cause HIV infection. If you are infected, then discuss treatment with your doctor. If you can get to a clinic, if you have a doctor, talk to them about it. Contact us at heintentsvictory.com. We'll be glad to do what we can to help you through this process. Most people who find they're infected feel like they're going to die that week, that month, or that year. And the truth is you don't. But there are things you can do to live a healthier, better life. Rest as much as you can, eat the best way you can, eat a healthy diet, refrain from drug and alcohol abuse, don't share needles, don't donate blood, maintain a positive attitude, get the symptoms of depression treated promptly. I mean, it's hard. Life is difficult as it is, and when you're facing it with HIV, it's even more difficult, but it's not the end of the world because there's hope. But for those living with HIV and AIDS, the hope is not in a cure. It would be wonderful if there was a cure. I would be just blessed and glad. But the fact is that HIV is a virus, and there is not even a cure for the common cold. No, I don't think there'll be a cure in that sense. There'll be long-term treatments, and that'll be great. But what's better is a hope that lasts into eternity. The truth is that God is still a God of miracles, and He sees you as valuable. No matter what you and I have done before, we can leave it all behind at the cross of Jesus. If we'll just understand how much God loves us, and it makes no difference what we've done in the past to get where we are today, if we'll just recognize it's at the cross of Jesus, where He died for us, where He rose from the dead for us. It's there that hope springs forth and we have new life. Yes, there are often physical consequences of our behavior, but Jesus redeems our lives. He gives us new lives. I've often said He gives us a new life, an abundant life, and eternal life. There is hope for those infected with HIV, and that hope is Jesus Christ. So, know this. God still has an eternal plan for your life. It may be that you have the medications available. It may not be. I'm not sure on that. But what I am sure is that Jesus loves you and me, that He has a plan for our life, and it goes far beyond this physical life on earth. It goes all the way into eternity. I encourage you to know today that there is that hope, and His name is Jesus.